Dental Nachos crew, this is Paul Dr. Nacho. I'm sitting here with a GP turned endodontist, my friend, new dentist boost camp speaker, Dr. Scott Levy. Dr. Scott, tell us why did you leave us in the GP world of full contact arts and crafts, denture adjustments, class 2 composites where the ring flies across the room, pings on the floor, and the patient says, do we need that? And you're like, kinda, we need it. Why'd you leave us? Tell us about that.
Well, I can still make the ring fly across the room.
That's true.
That still happens.
Yeah.
And you just kind of pretend like that is a normal thing. I left you guys not because I didn't love, I liked being a GP, but I found my thing. I started doing more root canals and started enjoying how my daily flow felt when that was my main procedure. And I liked it, and I just kept doing more of it. And then it's held true. I enjoy doing it every day.
Yeah, I mean, what's the treatment planning seminar for endodontist like? 30 seconds? Do you want the root canal or not? End of treatment planning seminar. So I'm fresh off a day of full contact arts and crafts, a lot of decisions in the general dentist life. So I applaud you. So tell us a little bit about your daily dental life. You're an endodontist. Where are you practicing? Tell us about your practice and what you do.
Sure. So I'm practicing in media. We are a patient-centric endodontic office. We try to have all the fun toys, CBCT, microscopes, fully equipped. Our day is like we start at 9. Generally see a patient about every hour. Some emergencies mixed in there, and help a lot of people that, believe it or not, are happy to see us. Hard to believe, but a lot of them are in pain. So
yeah, you take the thorn out of the lion's paw. Now
we do.
We may look like we're only 25 years old, but we go way back-ish to when CBCTs were not so common, right? And what dentists love to do? Technology shame. One day, Scott, people will have holograms in their office and they'll be shaming us. See, look at these. So tell me though, and I like to add value wherever I go and have you add value. What do you use a CBCT for as an endodontist? Just walk me through your workflow. Is it diagnostic, mid root canal, just for fun? What do you use?
Most of it is pre getting the patient back. So most of it's diagnostic. I also do mid treatment. If I can't find a canal, I think it's there, I'm not sure where I'm at, I can take a mid treatment CB. But yeah, generally it's everyone gets one before they come back. I really think for endodontics, it's the new standard of care. Before I even look at them, before I meet them, I've already reviewed their scan. I kind of make a game plan. I can start seeing if there's any apical lucencies developing, if there's MB2, which most of the time there is, unfortunately.
It is real. I always thought it was made up, but it's
it's a real thing.
Let's say, I use the example of having a map. Now we have ways. What are some of the things that CBCT shares with you that we missed on 2D? You said MB2, presence of that, lucencies. Where do you get surprised? Like, oh man, would have never seen this on a PA.
Let's see. So you have an idea of how, like, I guess the thinness, or like, say you have a number 30 and you've got a mesiobuccal root and the mid root is really thin. You're going to have an idea that maybe you don't want to instrument that to a larger size. You could gotcha. So you kind of have a game plan. It's like a map going into it. Of course, your game plan can change, but at least it gives you more of a concrete idea of how to treat patients.
I think that's how you should describe it to patients. That Waze app in your phone where you drive and it tells you, kind of gives us a heads up, on what's going on there.
Oh, and the other thing I can do is estimate working length, which has been very valuable, much more accurately than your PA. So I'm pretty much, I can estimate it within a millimeter 95% of the time. I still check with the apex locator, but it's nice to have all these checks and balances.
Nice. I like that. So you've been an awesome contributor to our speaking CE team. You're going to be a Super Dentist Boost. We're going to talk for a while, but I like to, share that our Super Dentist Boost event is coming up February 26th to 28th. It is going to be 18 hours of live CE on TV. And our dental people, Scott, I don't know what they are. They're very dentist cheap. That's their thing. So if you text in, you will get 18 CE credits for only $18. Scott, we bring you to these events because everybody loves an endodontist. What are you going to be speaking about at Super Dentist Boost?
Yeah, so I'm going to be showing you guys some fun cases, things you might not think could work, but a lot of them do. Yeah, so I'm going to just show you some fun endodontic cases and kind of go through just some technique stuff, just some things to think about how to do a better job with your own endo, and also what can be done.
I like that. It's also, dentists crying on the inside. You're doing an endo that takes 2 visits of 3 hours like dental school. There's no profit. Nobody's happy. Scott will help you feel like this dentist, making good decisions with your mind, your words, your hand skills.
I want to feel like that dentist.
It's even me, who doesn't do endo in any way, shape, or form. We used to have an in-house endodontist for a decade. Now I happily refer them right on to our friendly endodontist near us, to collaborate. But even me, I always learn something from you, because it's about general dentists. We are the first people to see the patient. So it's about diagnosing. It's about managing expectations. It's about seeing how tough things are. So I really appreciate you sharing that with us. Now, Scott, tell us about how have you enjoyed being part of the Boost events in the past?
I love being part of the Boost events. I always felt like when I was a young GP, and like Paul said, believe it or not, we're not 25. But when I was a young GP, I was looking for something like Boost, and it was not available. So I'm happy to be a part of that team that can kind of help new dentists. I think it's a needed part of a practice life, just really get you over the hump and to speed the learning curve up.
I appreciate it. And we're just trying to raise the game for everyone, because you deal with general dentists as referrals, and the more people know, the better it is for the patient, the better it is for your own sanity, the better it is for your own stress level. And endodontics can be something that can throw us a lot of curveballs at all angles. That's why you guys are called on to relieve pain, sometimes bail us out of challenging situations. So I appreciate you sharing with us, Scott. How can people learn more about what you do? What's your website for your practice?
So my website is mediaendo.com, Media Endodontics. You can check it out. I guess my email is on there. If you want to send me an email, you can. pulpedout@gmail.com. If you have questions, certainly feel free to shoot me an email.
Awesome. And before we go, I can't miss you. You have a big life event coming up. What's going to be happening to your family soon?
I do. This is probably the biggest announcement. Yes, I'm having 2 identical twin girls coming up pretty soon.
Awesome. That is great. I mean, it's amazing. They just send you to the hospital as you two, as 2 people. You leave with 4 people, no checks and balances, no tests you have to pass, right? We put more effort into being a barista at Starbucks than we do to training our parents. But people come over and help you. Nobody wants to come over and watch your dental practice, but they will want to come over and see your twin girls. So that's awesome. What names are you guys considering? K-File?
It's a little Gutta and Percha.
Yeah, I like that. I think you should go for it. Well, Scott, you're an awesome friend of Del Nachos, awesome friend of me. I really appreciate it. Guys, don't miss out on Super Dentist Boost. It's going to be an amazing event. Restorative dentistry, implants, endo, practice management. You get live C on your couch. Watch this. Sit on couch, turn on computer, phone, TV, whatever. Watch the CE, enter the code. You get live C. So, Scott, you're going to be a speaker, but when the show's over, you're going to then turn yourself into what?
A watcher. I am.
You need to see yourself, right?
Right away. I'm looking forward to it.
Yeah, you get some see. So just text Boost to 215-543-6454 for the hashtag most dentist cheap prices imaginable. Thanks so much for being with us, Scott.
My pleasure. Can't wait to do it.